Hello students and my dear friends. So in this session, we'll discuss one of the important viral infection, that is hepatitis B virus, which is also called as serum hepatitis. So in this session, we'll discuss morphology, antigenic structure, mode of transmission, clinical features, and laboratory diagnosis. So in the part 2, we'll discuss prophylaxis and treatment strategies we'll discuss. You see the morphology. So this virus, it belongs to the family of Hepatnaviridae. So this is the only virus, means only hepatitis virus which consists of DNA as genetic material. We have discussed in the previous videos, like all hepatitis viruses are RNA viruses except hepatitis B. So hepatitis B is the DNA virus. So it belongs to the family of Hepatnaviridae. It is easy to remember. Like you can see Hepa DNA viridae. So this by this you can remember it is a DNA virus, and it is a complex virus, which means it has complex symmetry. So what is complex symmetry? So this virus, it do not conform either icosahedral symmetry or like a helical symmetry. So they possess the like a complex symmetry, and the size of virus is 42 nanometer. This is a complete virus particle. The size is 42 nanometer, and it is a double shelled particle. And if you see, this is the outer surface. So this outer surface or envelope, so this envelope consists of HBsAg, which means hepatitis B surface antigen. So this hepatitis B surface antigen, it is helpful in the sero diagnosis of hepatitis B. And next, it encloses inner icosahedral core. So this is the core, and the size of core is 27 nanometer, and it consists of HBC antigen. So this capsid, it consists of HBC antigen, that means core antigen. So C stands for core. And inside of this one, circular double-stranded DNA and DNA polymerase enzyme is present. So in this strands, one strand is complete strand and another is the incomplete strand. So that is like a plus strand and like minus strand. So in this, the plus strand is like a incomplete and other is the like a complete one. So which gives partial appearance of double stranded DNA and partial appearance of single stranded DNA. And inside of this one, polymerase enzyme is present. So this polymerase enzyme, it repairs the gap between the like incomplete strand, and it makes the like a complete, like a double stranded DNA. Next, when we observe under electron microscope, so when we take the like a serum and when we observe the serum of the patient under electron microscope, so it shows three type of particles. So the first form is like abundant form, so which we can see more in the number, which is a spherical particle, which means it is like round in the shape, and it is having the 22 nanometer. The size of this like spherical particle is 22 nanometer. And the second form is tubular form or filamentous form. So this is also like a 22 nanometer in the diameter, which is having like varying length. So these two forms, such as spherical form and like a tubular form, they are antigenically identical, and they are the surface subunits of the hepatitis B virus. And next, third particle means this is complete virus particle, so which is a double shelled spherical structure, so which is having the like a 42 nanometer. So this is the complete hepatitis B virus or Dane particle. So why it is called as the Dane particle? It was first described by the scientist Dane and his co-workers in the year 1970. So that's why it is called as the Dane particle. So next, antigenic structure. In that HBsAg, so HBsAg means hepatitis B surface antigen. So the scientist like Blum and his co-workers like in the year 1965. So they describe a protein antigen. So they find out the like a protein antigen in the serum of Australian aborigine. So this antigen gave the positive precipitation reaction with the sera from the two hemophilic patients. So these hemophilic patients, they have received the like multiple transfusions. So this is named as the like Australia antigen. Previously it was named as the like Australia antigen, and after that, like it is established or it is identified as the surface component of the hepatitis B virus. So it is called as surface antigen or envelope antigen or envelope protein. And next, hepatitis B surface antigen HBsAg. So they carry the group specific antigen. So what are that group specific antigens? That is A. And again, two types of specific antigens such as like D or Y and W or R. So based upon this, four antigenic types are there. So based upon this like a group specific antigen, four antigenic types of HBsAg are classified such as ADW, ADR, AYW and AYR. ADW, ADR, AYW and AYR. So these are like markers. So they are like useful markers in the like epidemiology. So if you see ADW, so this it is predominant, like it is present worldwide, and ADR it is present in Asia, AYW it is present in Africa, India, and Russia, and AYR it is present in Africa, India, and Russia. And additional surface antigens are present. They are like Q, X, F, T, J, N, G. So, but they are not fully characterized. Next, HBC antigen. So, C stands for core. So, it is a core antigen or nucleocapsid antigen. So this core antigen consists of group specific protein, and HBC antigen cannot be detectable in the patient's blood. But if you see HBsAg, hepatitis B surface antigen can be detected in the patient blood, but HBC antigen cannot be detected in the patient blood. Then how we can identify this HBC antigen? So this HBC antigen is present in the liver cells, and this can be identified by using of immunofluorescence technique. Next, hepatitis B pre-core antigen or HBE antigen. So HBE antigen, remember E stands for like a hidden antigenic component of the core. So hepatitis B pre-core antigen or hepatitis B hidden antigenic component of the core. So this is also appear in the serum along with the HBsAg, but only for few weeks. So after that, it disappears from the circulation or it disappears from the serum. So what is this HBE antigen? So it is a hidden antigenic component of core, which means it cannot be seen in the like a serum of the patient. So HBC antigen and HBE antigen. So these are immunologically distinct, but they are coded by the same gene. Next, viral genes and antigens. So as I showed you in the like a previous slide, like previous picture, so the virus genome, it consists of two linear strands of like a DNA, like they are held in the like circular configuration. So which means they consist of like circular double stranded DNA. So in this double stranded DNA, one strand is the complete strand and another is the like a incomplete strand. So, like the plus strand. So here in the two strands, one strand is plus strand and another is the minus strand. So the plus strand is the incomplete strand and the minus strand is the complete strand. So this gives a partial appearance of double stranded DNA and partially single stranded DNA. And next, along with this one, like a viral DNA polymerase enzyme is present. So this polymerase enzyme, it repairs the gap in the incomplete strand. So that's what it make the like a fully double stranded DNA. Again, genome has four genes like now with the like different regions, and they code for different antigens. So what are those genes? Like S gene, C gene, P gene, and X gene. And out of this, P gene is the largest gene, and it codes for like a DNA polymerase. This codes for polymerase protein, and this P has enzymatic activities such as it code for like a DNA polymerase and RNase and H. And next HBX antigen and its antibody. So this is mainly found in the like patients who is having the like a severe infection. So in case of chronic hepatitis or otherwise in case of hepatocellular carcinoma means like a liver cancer, in these cases we can see the like a HBX antigen and its antibody. Next, cultivation and stability. So this virus cannot be cultivated in the laboratory. So we cannot grow them in any tissue cultures or cell lines. So limited production of the virus. So and proteins. So we can obtain from the like cell lines which are transfected with the HBV DNA, and this virus it survives heat at 60 degrees centigrade for 60 minutes. And how this virus can be inactivated, it is inactivated at 100 degrees centigrade for 5 minutes. So if we maintain a temperature of 100 degrees centigrade, so within 5 minutes this virus is inactivated, and it is inactivated by using of formaldehyde and 2% glutaraldehyde solution. So this formaldehyde and glutaraldehyde, they are higher level disinfectant solutions. So that's what generally 2 percentage of glutaraldehyde. It is used in the treatment of invasive diagnostic equipments. So for like disinfection of invasive diagnostic equipments, we use 2 percentage of glutaraldehyde solution. And this virus, it can be killed by using of autoclave. So such as like in the autoclave, we maintain the temperature of 121 degrees centigrade, 15 lb pressure for 15 minutes. So we can kill this virus by using of autoclave and even by sodium hypochlorite solution. Sodium hypochlorite solution is also high level disinfectant solution. Next, modes of transmission. So there are three important modes of transmission, such as parenteral, which means direct inoculation into bloodstream by the like a contaminated blood or blood products, or like in case of intravenous drug abusers, or like contaminated syringes, needles. And next, perinatal. So this from mother to the like a fetus, and even sexual contact. So parenteral, perinatal, and sexual contact. So parenteral transmission. So this is because of the accidental inoculation of minute amount of blood, either during needle stick injuries. So needle stick injuries, like they contribute for like almost 30 percentage of, sorry, they contribute for the like hepatitis B viral infections, and even contaminated blood products. So or fluids, which consist of hepatitis B virus either during medical, surgical, or even dental procedures. So when compared to the like a HIV as well as the hepatitis C virus, HBV is more infectious. So as I told you, it is one of the like infection which is mostly transmitted by needle stick injuries. So that is 30% chances are there. So the like infection rate is like 30%. And whereas if you see the like other viruses such as hepatitis C virus, it is very less only, that is 3%. And in case of HIV, it is very less, that is 0.3 percentage. Next, perinatal or vertical transmission. So this is from mother to the fetus. So it carries the like carriers mother's blood contaminate the mucous membranes of the newborn. So if the mother is having the, like a HBS AG positive or HBE positive, if she's having the like infection, then it contaminates the like mucous membranes of the newborn during the like a birth. Suppose if the mother is having the like a HBE antigen, so if the mother is showing like HBE antigen positive, so there is a maximum risk. So why? Because HBE antigen, as I told you, it is a hidden antigenic component of the core. It is present only for particular period of time. So generally we call them as like super carriers. So super carriers means those who have HBE antigen in their blood, they are called as like a super carriers. They are like highly infectious. Even minute amount of blood also can transmit the infection or serum. Next, sexual transmission. So hepatitis B virus, it is present in the body fluids such as semen and even vaginal secretions. So male homosexuals, they are at the higher risk of developing infection. So clinical features, uh, if you see the onset is slow, so it's like the infection starts very slow, that is insidious, but it become more severe. So the incubation period is of 6 weeks to 6 months. So the patient may present like a subclinical infection, which means there may not be severe symptoms immediately, or otherwise they may show the like acute hepatitis or chronic hepatitis. So they may present with a subclinical infection or acute hepatitis or chronic hepatitis, and fever is less common. So the patient has fever, but that is not high grade fever. It's very low grade fever, and jaundice is rarely in the children, but jaundice is common in the adults. So HBV infection, it is divided into like three phases, such as pre-icteric phase, icteric phase, and convalescent phase. So icteric phase means like jaundice phase, and pre-icteric phase means before entering into the jaundice phase. Like the patients will be in the like a pre-icteric phase, they will be having the like a pre-icteric symptoms, and convalescent phase is like long phase. Okay, so if you see the symptoms in the pre-icteric phase, so what are the symptoms we can see? Like malaise, like anorexia, which means like loss of appetite, and weakness. Okay, so fatigue, weakness, and myalgia, such as pain in the muscles. Okay, and nausea and vomiting. So fever, abdominal pain. So these are all symptoms of the pre-icteric phase. And a minority of the patients, they develop the like a arthralgia, which means pain in the joints, serum sickness, and glomerulonephritis. So this is serum sickness, glomerulonephritis. So they are because of the like immune complexes. So which means it is a type 3 type of hypersensitivity reaction. So they develop as a complications. Next, second phase, such as icteric phase, which where we can see the like a jaundice in the patients, such as you can see the like a yellowing of the like a sclera. So yellowing of the like skin also we can see, and we can see the like pale stools and dark urine. Next, convalescent phase. So convalescent phase is like a long phase. So the patient has malaise and fatigue. So uncomplicated hepatitis. So generally this is 8 to 10 weeks, but symptoms persist for mild symptom persist for more than 1 year. And here humans are only reservoirs of infection. So either cases are carriers. So they are the sources of infection or reservoir of infection. Next, hepatitis B carriers. So hepatitis B carriers, they are of two types: super carriers and simple carriers. So super carriers, so as we discussed, so super carriers, they have HBe antigen in their blood, which means hidden antigenic component of the core. So the patients who are having HBe antigen in their blood, they are highly infectious, which means like small amount of blood or minute amount of blood. So we can say is like one drop of blood or serum is also enough to transmit the like infection. So why blood? So means this patient's blood, it consists of like higher titers of hepatitis B surface antigen and DNA polymerase, and hepatitis B virus is also demonstrable in the blood. Next, if you come to the like simple carriers, so simple carriers are more common type of carriers. So they do not have HBe antigen in their blood, and they have low level of HBsAg in the blood. So hepatitis B virus and DNA polymerase, they are absent. So they are less infectious. So when compared to the like super carriers, like they are very less infectious, which means like we need large volume of the blood. So either in case of blood transfusion or blood product transfusion, so if they are like not properly screened, then only they can transfer the like infection. Whereas in case of super carriers, minute amount of blood also can transmit the like infection. And see, carriers, they can be divided into two types. So how they can be divided, and based upon the uh, like based upon the like organism, means which means how many months they carry the like organism, or how long they carry the like organism. Based upon that, carriers are classified into two types, like temporary carrier and chronic carrier. So temporary carrier, or like they harbors the like a pathogen, or they harbors the virus for almost 6 months. And in case of chronic carrier, so they carry the like infectious agent for more than 6 weeks. So next, immune response. So both humoral and cell responses occur. So as you know, humoral immunity is mediated by antibodies, and cell-mediated immunity is mediated by T cells. So in case of humoral response, so antibody is formed against to the like HBsAg, antibody to HBsAg. So this is associated with the like resistance to infection, and this is helpful, or this is useful indicator of past infection or recent immunity. And this is the only marker of hepatitis B vaccine. Next, antibody to HBc antigen. So antibody to HBc antigen is formed. So it increases rapidly following the like infection. And this antibody is not protective in the nature. It doesn't give any like immunity, or it doesn't give any protection from the like infection. So this antibody, the amount of antibody, that depends upon the duration of replication of the like virus, and highest titer of antibody, it is found in the like a persistent HBsAg carriers. And antibody to HBe antigen. So antibody to HBe antigen, it is seen in the serum of the patients with the like a low infectivity. It's the cell-mediated immunity. So in self-limited course of hepatitis B, so T cell function remain within the like a normal limit only. But in case of chronic infection, so like which means in case of defective function of T cell, so if the T cells are not working properly, then it leads to the like a chronic liver damage. So it favors the like a liver damage. Next, HBV and HIV co-infection, which means like some patients, they will be having the like a hepatitis B virus as well as the like a HIV infection. Suppose if the patient is having the like a HIV infection, so if they are having the like a means it is if they have the like hepatitis B virus infection, so there is a increased risk of developing like cirrhosis of the liver and hepatic carcinoma such as liver cancer. There are chances of getting liver cancer, but like hepatitis B virus, it does not affect the progression of HIV infection. So when we give the ART therapy to the HIV patient, so this hepatitis B virus, it does not affect the like a ART therapy. Next, laboratory diagnosis. So laboratory diagnosis is important one. So laboratory diagnosis, it is done by detection of hepatitis B antigens and antibodies. So we can detect either hepatitis B antigens or antibodies. So how these antigens and antibodies can be detected? They can be detected by using of ELISA or RIA, radio immunoassay. So here, like a rapid test. So rapid test, they give the like results in a short span of time, such as immunochromatographic test. So here, presence of HBsAg, presence of hepatitis B surface antigen. So it indicates the active infection. So which means the patient may be carrier, or otherwise the patient may be in the incubation period. So IgM antibody, which means anti-HBc antibody, indicates acute infection. So it appears early course of the disease. So here, as you know, IgM antibody forms early in response to the like infection. Anti-HBs, it is formed in the serum, which means this antibody is found in the like a serum. So it indicates the like a past infection, or so that may be due to the like immunity which is developed after the like vaccination. So after the vaccination also, so this anti-HBs antibody is formed. So the presence of HBsAg after the 6 months of acute infection, like it indicates the like patient is chronic carrier. So even after the like 6 months, even after the treatment, so still if HBsAg antigen is present, so that indicates the patient is a chronic carrier. And appearance of HBc antigen and along with the HBe antigen, if they show the like a positive, like a hepatitis B core antigen and HBe antigen, so that also indicates the chronic infection and high infectivity. Next, like the laboratory diagnosis, it is done by following methods. So the first one, detection of viral markers. So in that viral markers, what we can detect? We can detect the HBsAg, HBeAg, and HBcAg. And next method is viral DNA polymerase, and next polymerase chain reaction and biochemical test. And if you see the first one, detection of viral markers, in that first one is HBsAg. So this HBsAg, it is recognized as the specific marker for hepatitis B viral infection. So as I told you, so this is the first marker. So it is present in the blood of the infected person after the infection. And see, this is the antigen which can be detectable in the patient blood even before the elevation of transaminase enzyme. So transaminase enzyme. So this comes under the like a biochemical parts. Okay. So before the like elevation of transaminase enzyme also, this HbsAg can be detected, and in the onset of clinical illness. And higher levels of this HbsAg is seen in the pre-icteric phase. So before the like a jaundice, um, and this remains in the like a circulation throughout the like icteric or even the symptomatic course of the disease. And antibody is formed to this HbsAg appears within the few weeks after the disappearance of HbsAg, and they persist for longer time. And anti-HbsAg is the protective antibody. Next, HbE antigen. So HbE antigen, it appears in the serum. So along with the HbsAg, or like shortly after the appearance of HbsAg, but it disappears within the like a few weeks. So as we discussed, the patients who are having HbE antigen, they are highly infectious. They are highly infectious. Suppose if you see the like a HbE antigen in the patient serum, that indicates active intrahepatic viral replication, which means the virus, it is like replicating in the like liver cells, and the presence in the blood of HBV DNA and virions and DNA polymerase. Next, HBC antigen. So this is like it cannot be detectable in the serum, but how we can detect this C antigen? So this can be demonstrated in the liver cells by the like immunofluorescence. So antibody is formed, like that anti-HBC antibody. So this appears in the serum in a week or 2 weeks after the appearance of HBsAg. And this is the earliest antibody which is formed in the infected patient's blood. So this antibody present lifelong, and it is useful indicators of prior infection with HBV even after all markers become undetected. Viral DNA polymerase. So this appears transiently in the serum during the like a pre-icteric phase. And next to PCR, polymerase chain reaction. So by using of polymerase chain reaction, we can detect the like HBV DNA in the serum. So this is highly sensitive method. And so this HBV DNA, it is quantified by real-time PCR, and it is the, which means the HBV DNA, it is an indicator of viral replication in the liver, and it helps to assess the progress of the patient. So whenever we give the like antiviral chemotherapy, so we can like based upon this PCR level, which means based upon this like HBV DNA, we can assess the like prognosis of the like infection. Next, biochemical test. So in case of acute viral hepatitis, so which is caused by either A, B, C, D, or E. So generally the transaminase levels varies from like 500 to 2000. So which means like SGPT is higher than the like SGOT. So what is mean by SGPT? It is serum glutamic pyruvic transaminase. And what is mean by SGOT? Serum glutamic oxaloacetic transaminase test. So here the serum bilirubin level indicates the degree of jaundice, and it increases up to the 25-fold. Thank you. So this is part 1. In the part 2, we'll discuss about like prophylaxis, treatment strategies we'll discuss. So thank you for your patience.